Well, assalamu alaikum everyone. Good morning. I would like to appreciate my presence today in this great conference and giving my appreciation for the moderators and especially for Ms. Lamis and Mr. Muhammad Jaha for their great organization. So I will start to explain echocardiogram for non-echo staff during the cath lab. Here my objective. We're going to go through understanding the role of echocardiogram and learning the basic views, recognizing also the key pathologies, and discuss the hands-on tips and efficient, accurate imaging. So as you know, the transthoracic echocardiogram plays a complementary role in invasive procedure. Especially it's providing real-time dynamic imaging that enhances diagnosis accuracy. And the most effective way to apply it during cath lab is the ability to provide immediate feedback, make it valuable tool in the setting of the pathology especially. So what is the importance of echo during the cath lab? It's gonna go divided in three divisions: pre-procedural and during the procedure, and also post-procedure evaluation. During pre-procedure assessment, we're going to go through multiple examples. I have this example for the left ventricle image and the four-chamber view. As you see, the left ventricle is the most important to know the function about it, especially in the period to the PCI, and to know the regional wall abnormality, and also to take a quick quantification for the LV. Also, to identify any pathology like intracardiac thrombi. Identification of pathology period the procedure, including severe valvular disease. In this example, we have aortic valve on the 5-chamber view, and we have a severe gradient going across the valve. Again, also to identify the pathology period the procedure, especially if the patient is inside the cath lab, we're going to identify the conditions such as the pericardial effusion or the tamponade. We have three images here, different views, and different amount of the pericardial effusion. This is very critical and sometimes needs a quick access from the non-staff to know some views to provide some diagnosis for the cardiologist or the interventionist. Monitoring the complication and catheter position. As you see in the three images, we are monitoring by imaging and guiding the needle insertion of the pericardial effusion. To not touch the pericardial, we need to guide the doctor how to insert it and to not provide it usually with the bubble study. As you see in this image with the monitor, the pericardial anechoic space is filled with the bubble study to ensure the needle is not inside the chambers.
Yeah.
But as you know, the challenges during the procedure is always the limited space, stereo environment, and need a quick, operator dependency, especially when we are getting the real-time imaging. Post-procedure, always detecting a complication help to identify such as new regurgitation, ventricle dysfunction, or pericardial effusion. Before we put the patient in recovery, usually sometimes the doctor like to check if there is some complication after the procedure. Going in basic view, very quick, we have parasternal long axis, short axis, apical four-chamber, and subcostal view. These are what is necessary for non-staff echo. So we are going in parasternal long axis view. This view is very important to assess the left ventricle, right ventricle, and aortic valve, mitral valve, mainly the left side. We can obtain this when we put the probe on the chest of the patient and when we put the probe in the chest of the patient and the clock is on the 10 o'clock. Short axis view to check the aortic valve. We adjust and rotate the probe 2 o'clock to the right, to the left hip. And then we can evaluate the aortic valve. Tilting down, mitral valve and LV, RV are showing. This is the mitral, and this is the LV, and here we can see the RV. Moreover, when we are going more down, we can see the papillary. This is mainly to evaluate the function, and also, as I mentioned before, it's very quick views to just give immediate diagnosis for the interventionist. Here, the apical view, we are going apically as it's administrated here in the image on the 3 o'clock, and we are showing the 4-chamber views, left ventricle, left atrium, and right ventricle. Here also we can assess all the function, any intracardiac thrombi, and also to see the fusion. Also to see if there is any fusion, especially in the cath lab, the subcostal view is very important to obtain. We're gonna put it in the xiphoid area and tilt down on the 3 o'clock, and then you're gonna obtain easily this view, and it's very important also if you have ASD closure. As any modality, we have limitation, image quality, and operator dependency. In the cath lab, we don't have cooperative patient to tell or to communicate. So usually our patient in supine position and fill with a sterile sheet or environment. So you need to know some technique. This is what I go in details, inshallah, in our workshop, how to obtain these technique and tips to obtain these images. But as example for that, sometimes you can't put your probe in the chest of the patient, so we are obtaining the images from the subcostal view. To recap and to conclude, why echo for non-echo staff is important. First, immediate assessment. We need immediate feedback to help in making quick clinical decision. Guidance during procedure. Guide the catheter placement, for example, and improve accuracy and safety for the procedure. Complication management, especially if there is any event of complication like tamponade or precardial effusion. Hemodynamic monitoring, providing valuable information for overall hemodynamic status. Enhanced communication, especially for the cath staff, if they learn the TTE, usually it's gonna allow better communication with the echocardiogram team and other specialists, leading to coordinate patient care. Patient safety, early detection of issues such as wall motion abnormality or any valve dysfunction, prevent adverse outcome and improve patient safety. Skill diversification adds also skill for the cath lab team, making them more capable to handle wider range of clinical scenarios. Resource optimization. If you know these skills, you're gonna ensure that the patient still receive timely and effective care, and eventually improve the outcomes. It's all about the decision making and timely intervention. Thank you.